I'm Dr. John Burns. I'm a board-certified plastic surgeon. I'm from Dallas. I did a lot of my training away from Dallas, but was anxious to get back. Went to Highland Park High School, Vanderbilt University, and then the University of Texas for medical school and postgraduate training. We practice at the Dallas Plastic Surgery Institute. We're a large group of board-certified plastic surgeons. We have right now 13 doctors in our office. We might possibly be the largest plastic surgery practice in the United States. And we feel like we're world-class plastic surgeons dedicated to treating our patients as we would want to be treated with first-class plastic surgery services. So part of our practice also is economy of scale, and so we're able to have a Quad AF, which is a certified agency surgical center with 4 operating rooms, world-class nursing staff. Adjacent to the operating rooms, we have a hotel called the Cloister at Park Lane where patients will overnight. And it's been a big asset to our practice to be able to treat our patients in our offices in a safe environment that feels more like home than a hospital. We also have a skincare center called the Epicenter at Park Lane. We offer world-class lasers, skincare, Botox and fillers at the Epicenter location. I knew early on that I didn't like to sit down, so honestly I didn't want to have a desk job, and being a doctor allowed me to interface with patients, and I consider myself to be a people person, so it was a way to run around, not have to sit at a desk and interface with people. The reason I became a plastic surgeon is because I like making things whole again, putting the pieces back together. This is a happy specialty. Nobody's sick, nobody dies, everybody does well, and it makes me feel very good to be able to help people and put the pieces back together. In terms of plastic surgery, I've dedicated my practice mainly to cosmetic and aesthetic medicine, and a big part of my practice now is basically Botox and facial fillers, where we use non-invasive means to rejuvenate the face. That's been a lot of fun for me. It's been a big part of my practice in the last 5 years. We're very fortunate to have some great partners as well. So our practice is now in the top in the country in terms of volume of facial fillers and Botox that we do. We have state-of-the-art techniques where we use microcannulas and not needles to do our injections with, decreasing bruising and healing time. So in terms of a result, that's an important thing to discuss with your board-certified plastic surgeon. There's no guarantee of result, but we have a very reasonable expectation. 3D photographic imaging is becoming more and more accurate these days, and so I use that technology in my office to illustrate to patients what they could expect to look after procedures. We can use 3D from anything from Botox to facial fillers to rhinoplasty, which is nose reshaping, genioplasty, chin reshaping. It's big in breast augmentation to be able to get the right size. So that's been a big help to me. But in general, I like to be very honest with my patients, and together we come up with a reasonable plan and set reasonable expectations. Part of my job I feel like is being a psychologist. With plastic surgery, we make some pretty impressive changes to a person's physical appearance. With all of our surgeries, we'll pass out a mood chart. It's a little funny cartoon, but it's very accurate in terms of the way a patient typically feels after surgery. You go through a period of elation, you go through a period of sort of a self-doubting as you swell and bruise, and then as you continue to heal, your mood continues to improve. Most plastic surgery procedures we do have a greater than 90% satisfaction rate. Things like breast augmentation, even up to 98%. So I wouldn't do what I do if I didn't expect I could give a high satisfaction rate to my patients. Well, standards are all we got. So the basics are graduation from medical school and a 1-year internship. Above and beyond that, we like to use the American Board of Medical Specialties to certify physicians in their respective specialties. In this day and age where marketing sort of outweighs accreditation, it becomes extremely important for a patient to be aware of what is legitimate and what is not so. And sites like Top10MD really help differentiate that and educate patients about proper credentialing. Well, important to me and important to people in my practice, the other doctors, is quality. So we want to be a very high quality practice. So we get calls all the time to lend our name and our credentials to marketing agencies. And we're very selective in how we do that. The reason is that we want our patients to know that we have done everything we can to be the most well-trained, to go through all the right channels in terms of credentialing, and to give the patients the best chance of having a great outcome.